to Talkin Business. I'm Joe Catrambone. I'm CEO of the Stuart Martin County Chamber of Commerce, and I'm delighted today to have Dr. Ashley Salomon with me as our guest. Doctor is a member of the Chamber, and I'm a strong advocate and believer in chiropractic. And so a little quick story, and then I want you obviously to tell everyone about you. But I'm going to guess 40 years ago, at least, been in Martin County over 40 years ago, I hurt my back. And my doctor sent me to a surgeon. Well, what do surgeons do? Surgery. It scared me to death. My father-in-law said to me, go see a chiropractor. I said, oh, I was so afraid because I was in such pain. And all I knew about chiropractic, I'd never been to one, was that people call them bone crackers, and they manipulated, and I was really in a lot of pain. Anyway, I'll make it a long story short. I finally went to a chiropractor, and he got me back on my feet and got me going, and I've been going to chiropractor ever since. I go at least once a month. I call it for a tune-up.
Yeah.
So y'all do a great job, and I think I guess it's because chiropractic is more a study of the bone and the skeletal structure, where an MD they're not into that.
It's a lot more than that these days.
Yeah, is it?
We have different scopes of practice. So medical doctors have 3 tools in their toolbox, so to speak. They can prescribe, inject, or operate. When we study, we learn the same things. The only difference is when they learn pharmacology and drugs, we learn more about the body because we can only use the body to heal the body. And we know that the brain controls everything. And then all we do is we clear up what messes with the communication between the brain and whatever is less than perfect. So we just clear up that signal and the body takes care of itself.
It is amazing. I mean, the first chiropractor I went to was in Titusville, and he was a Palmer graduate. And so I was used to, I didn't realize until actually I moved to Stuart that there was a difference in the schools, in the chiropractic schools.
Yeah.
So I moved to Martin County, and there was no Palmer person in Martin County. So I used to I would drive to Titusville whenever I needed to go see my chiropractor friend.
Wow.
Who graduated from Palmer. And then subsequently, Dr. Rubino, who's dead now, and I can't remember the other, but they were both Palmer people. And so I was then, but it was probably a couple of years that I was driving up to Titusville to get chiropractic care because I wasn't a Palmer person. So can you explain the difference? What school did you go to?
I went to Life University in Atlanta, Georgia.
Okay.
They do change, and I remember asking when I was looking to go to school. I wanted to go to the best one in our country, and I asked about 14 different of the physicians that I had been shadowing, and all but one of them said that Life is the current school of the highest number of techniques and education, and I wanted to do that. The only one that said otherwise was not a physician I wanted to follow in his footsteps at all. So it was an easy decision.
So each school teaches a different methodology? Is that how it works? Or do you learn the same thing and can do the same thing a Palmer graduate can do with your degree or your education? You can do the same thing a Palmer person?
Yes, we do the same bases, and then we have extracurriculars. There's actually over 400 techniques now as far as adjusting. So a lot of chiropractors don't even adjust the same. Chiropractic is the science, but the adjustment, the technique is the art, is the application.
So, yeah, I know I went to a chiropractor one time that didn't touch you really, did no adjustment whatsoever. It kind of put you on a table and a vibrator and a chair, and it didn't work for me.
I was about to say, that doesn't even sound like an adjustment if you're not
Yeah, I mean,
changing anything.
yeah. No, I like to, I like to have my head snapped, and so I like that Palmer technique, and so I'm 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 obviously not well informed about the other schools and what they teach and how they do, what methodology they use, but I just the Palmer thing worked great for me, and it still does.
I actually learned some of the techniques that are very different from that twist pop because I grew up, background, I hated chiropractors growing up. So, long story is funny of how I became one, but my technique is very precise and very gentle, and instead of the twists and pops, and it's very specific. So if a single segment is misaligned, instead of twisting everything this way and twisting it all that way, it moves just that one back in alignment. It takes the stress and pressures away, and you regain so much just being specific.
I know one thing, a giveaway for me, obviously I lay down at a table. It's always one of my legs are out of alignment, shorter than the other. So I guess that's
Yes.
from your hip.
Yes.
So yeah, so I know if I start walking funny, or I probably, it's not noticeable, but I can feel it.
Yes.
And then so then I know, and I'll always say, how's my legs? No, not good.
So you're in tune with your body if you notice it. This is actually why, when I graduated school, over 90% of Olympians used chiropractic care, because those little nuances, those discrepancies, make a difference. Somebody that's like competing at a higher level or is doing a lot more physically, it's really important to be balanced and full muscle recruitment and engagement and optimal function. So.
Yeah, well, when I hurt my back, I had my own business, and to save money, my partner and I were starting out, we unloaded trucks ourselves. So that's how I hurt my back. I was carrying a 75-pound box of, I was in the Hartz Mountain pet supplies. So I was carrying a box of gravel, bird gravel, 75 pounds, and I stepped through the pallet. The pallet broke and twisted, and I fell.
Oh,
and it
no.
landed on me. The box, 75 pounds.
Oh.
So that's how I hurt
I'm
my
sorry
back.
to hear that.
That was a long time ago, but it's still at times. I think because I stay on top of it, it doesn't bother me as much as it does. So I got right into talking about chiropractic, but. How did you end up in Martin County? I love to ask people. To me, it's fascinating to me.
Yeah.
So how did you pick or choose Martin County?
Oh, I'm a Florida baby. I grew up in West Palm, and I only moved up to Stuart, Jensen Beach, actually, a year ago, almost today. And
Really?
Yeah, I never would have left West Palm Beach. I grew up in the acreage. It used to be the boonies. People would come out to my neck of the woods to go mudding. Now it is not that anymore. It's the busy hustle and bustle, and no one has time for a smile. And that's not where I want to have a family. So I just moved up here, and I realized when I got here, I'm like, these are where all of my people moved to, and no one gave me the notice.
Yeah, it was interesting. From 80 to 90, 1980 to 1990, Martin County's population grew from 50 to 100,000 people in 10 years. From then till today, we've grown about 2% a year, which still makes us one of the slowest growing communities in the state of Florida. But you hear people say, oh my God, the growth is rampant, it's going crazy. It really isn't. It's just attrition,
Yeah.
But so much of that growth from 80 to 90 was from Miami-Dade, Broward. I mean, there was that and with a smattering, especially in Martin County, because of Grumman, they were based in New York, so a lot of their people moved here. So there was a smattering of northeastern people and some Midwest. I don't know none of those people moving from Miami-Dade and Broward were born there, so I don't know where they came from. Probably the same places, but that was the exodus from South Florida is what caused our big growth spurt in that 10 years. So um, I don't like to go south of Martin County. You know, I spent 20 years or so in Titusville.
My father's birthday is tomorrow, so I'm going down south.
Oh, are you?
And that's the only reason I go anymore is to visit them because it's not the same.
Yeah. Well, I never spent a lot of time in South Florida when I lived in. My first stop in Titusville, in Florida, was Jacksonville. And I spent a couple of years in Jacksonville, and then I moved to Titusville, which was Kennedy Space Center. So we had, you know, we talked about our season here with when we get an influx of winter residents. Well, we had that 12 months a year in Titusville because of Kennedy Space Center. So we
Yeah.
always had an influx of tourists come in and visit. What ailment, and maybe, what ailment do you treat mostly?
Well, I know a lot of people know chiropractic as back pain, neck pain. Only 1/10 of nerves feel pain. I tell people it's just the body's check engine light, so don't ignore it. But the other 90% control your movements, they control your organ systems and functions. And yes, I take care of pain as default, but that's easy. That's kind of boring. It goes away. I love taking care of the things that really amaze people. For example, if there's usually a pain in the upper neck, I know that it usually goes along with like clicking, clenching, or grinding in the jaw, ringing in the ears, headaches, balance, and sleep, mood, or hormone irregularities. So somebody might come with pain, and I know in my mind, I'm like, oh, I expect these things to go away. And I kind of ask them, like, do you have these things? Like, how do you know? Your body's mapped out. So all of your functions, we know where it comes from. So I enjoy finding things that are improper and clearing it and seeing them. I didn't know this could be better. So you might ask what ailment, but really I just clear up the nervous system and I see the body heal itself of anything, just like a cut on your hand. It knows how to heal.
So you can determine almost immediately what the problem is when they tell you the ailment.
I actually have a chart in my office I give to them. I'm like, you might want to check this area right here and see some of the things that it correlates with.
What advice would you give especially to someone who's never been to a chiropractor? What advice would you lend or give them that why they should come and see a chiropractor? Even if they're not, even if I'm not feeling bad,
Yeah.
I'd feel better when I leave.
No, that's a great question. Because, again, only 1/10 of nerves feel pain, but the rest control functions. The advice I would say is to check things out because the issues get pretty bad before it activates those pain fibers to alert you to a problem. So I'd rather raise healthy kids than fix broken adults. And chiropractic today is where dentistry was 100 years ago, where they used to only go to the dentist when they had a toothache. But by that time, there was definitely a problem. There was usually drilling and filling because it was a cavity. Now we maintain our oral hygiene. I love getting to see people coming in for that because it's so much easier to maintain our spinal hygiene, especially since it is how we control everything in our body. And it's just so much better seeing things where people are just healthy and they maintain their health. Because Hippocrates had it right. An ounce of prevention is worth a pound of medicine.
That's very true. Yes, it is. The older you get, the more you realize that. So one of the things that, and I noticed in your bio a little bit, you do pediatric.
Yes.
It amazes me when I see women, pregnant women, and then women carrying newborns. So what do you do with a newborn?
So I know it's a weird concept when we only think of chiropractic as pain, but really it's function and wellness. So a mom-to-be, the pelvic outlet is made up of 3 bones and 3 joints, and if it's misaligned or there's a slight displacement, it can prolong or complicate a delivery. So I warn my expecting mothers, I'm like, be nearby, be able to get to the hospital quickly when you're close to your due date, because I've only been yelled at one time, and I'll tell you, when you get that...
Sorry.
You're fine. But only one time it took getting that, like... Right there. There you go.
My daughter calling.
Oh, you're loved.
She lives in Europe. But anyway, so you make delivery easier.
Yes.
Because you line,
Yes.
do you actually line up the fetus into the birth canal?
The body takes care of itself doing that, but if you have a distortion to the pelvis, the uterine ligament, the round ligament, ovarian ligament, all of those, the connective tissues are distorted. And it's like having a balloon with tensions at different points, and that disforms it so the baby can't turn properly. And then we take care of babies because during delivery, the studies find that there's about 80 pounds of pulling force on the head and neck of a newborn baby with a natural delivery, as far as not natural in the sense of like, oh, water birth or something that somebody does like that, but a regular vaginal delivery versus forceps, vacuum, C-section. It just gets worse. So we tend to have babies with misalignments here, and you see in kids like colicky, asthmatic, ear infections, bedwetter, latching problems, sucking, rooting reflex issues, and it's all from right here. In adults, it becomes other things later in life, but it's easier to clear it young, and they develop without a misalignment. It's just
So
easier.
if that infant
Mm-hmm.
is out of a line,
Mm-hmm.
obviously they're in pain and can't tell you.
Not pain.
They're not in pain. What's their discomfort if they're out of alignment?
It's more of a functional thing because, again, only 1/10 of nerves feel pain. So it's more of the decrease in functions. So when babies aren't necessarily latching properly, or you're having colicky babies, the symptom might be in the digestive tract, but the source is in the nervous control of it. There's a lot of different signs or indicators. So we look at function, and then we just clear up the nerves that control that. Later in life, though, after that issue's been there for a while and it's snowballed, then they can start seeing like, oh, well, somebody gets headaches easily, or they get those clicking jaws, things of that nature. You can catch it early, though.
So it could, if that problem isn't treated, could it slows down development
It
or the
doesn't-
natural body functions?
It doesn't slow development, but it does decrease functions, and it's not very easily noticeable a lot of times. But it's really cool because I see this in adults. I didn't know I could feel this good.
Yeah.
And just the little changes, and you get that optimal function, that's when you notice the difference.
I bet you that makes you feel good when people tell you that, doesn't it?
Oh, yeah, that's
Yeah,
definitely
yeah,
the highlight of the day.
Yeah. Well, doctor, is there something that we haven't covered that you'd like to talk about? Something that you want our viewers to know, or about you or your practice?
There's nothing, I know we've just covered some of, I think, my favorite topics about it, but I really do believe everyone should be checked out simply because you don't know a lot of things going on under the surface. And I use analogy of a misaligned car tire. You know, the more you're driving on it, the more it wears down.
So you don't have to feel bad
Not at all.
to go to a chiropractor. You should go just for your well-being and your well-being.
Yeah, just like
Just
you
to-
go to the dentist before you have a cavity, so you don't have a cavity. But in this case, we're talking about your control system of your body. You want to keep that functioning well.
Well, it's very interesting, and chiropractic really has always fascinated me since I've never had back surgery, and I was recommended I have back surgery 40-some years ago, and I didn't, and a chiropractor saved me from going through that. So I'll always be indebted to the chiropractic field, and it's a fascinating, I think, science.
Yes.
You know, and what I really like about it is that you don't, that you study the structure, and you don't deal with. Will you ever see? I know it was an issue a couple of years ago, where chiropractors are going to be able to write prescriptions.
I hope not.
You hope not.
Because
Okay.
I feel like that's a second-rate like, if you're really good and you're educated in this one area and then somebody else starts dabbling in it, why go to somebody just dabbling in it rather than somebody educated in that area? If I need a prescription, I want to go to the person that's educated in that area because they're different scopes. So I would never, even if I was able to write a prescription, I would never go to somebody like me for a prescription. I would want to go to somebody that knows and was educated in the pharmacology.
Interesting, because I know I know that there was a lobbying effort by the chiropractic community. I can't remember how long ago it was for them to write prescriptions, and so that's interesting. That
I know a lot of things in chiropractic has changed. Like, we know things now we didn't know 10 years ago.
yeah,
Like, if somebody had a spondylolisthesis, big Latin word talking about if the bone kind of slips off, or a disc issue. We used to think you either need surgery or you have to treat it and hope it doesn't get worse. Now we know better. We know we can completely reverse that.
there's a procedure that I heard about, and I don't remember when, or that as you age, your disc, you lose disc, what's the material between discs? What is
Yes.
it, cartilage?
So it's made up of many components.
Okay. So there's an artificial something that they could put in there to cushion. Do you believe in that?
If you want to go the surgical route, that is the best route than if you're doing the operation route.
Okay.
But if you don't want operations, you're able to regain the disc health. Now, there is a certain threshold where you can't get the health back, but there's so many that we're able to see now where you can get that disc to regenerate.
Really?
Yes.
With exercise or
It's
manipulation or how?
It's completely tailored to you, like what caused it, undoing the root cause so that you can get the disc health back and make sure it's not going to just revert back to what it just was.
Whoa,
So it's very specific to you.
that's interesting. Nothing else you want to cover?
No, there's so much, and I thank you for all
Thank
of
you
your
so
great
much.
questions.
I thank you for your great answers. Have a great day. I look forward to seeing you.
Thank you so much.